make a video for pain behind the thigh, biceps femoris tendinitis. Today we're going to do simply the best sequence of exercises I know to relieve pain in the back of the thigh at home, especially if it comes from this muscle. That pain that goes down from the thigh to the side of the knee. And if it's your first time here, I help you swap that bag of medicine for easy exercises. And you don't need to be thin, young, or flexible to have good movement. This muscle is controlled by two parts of the famous sciatic nerve. If the sciatic nerve is irritated, it simply won't let the muscle relax. And that's where the pain behind the thigh comes from, as well as the inflammation, the biceps femoris tendonitis here on the side of the knee.
What we're going to do is simply the best way to mobilize, to release the sciatic nerve in this case.
Sit more towards the edge of the chair. It's important to keep your feet well supported on the floor. You're going to curl your spine from your head all the way down to your sacrum, to the end of your spine.
Let me take off the microphone here. Otherwise, you'll either hear my beard scratching or I'll keep hearing my neck making that little pigeon noise.
Start curling your spine, okay? Tuck your chin to your chest and keep curling, making a C shape with your spine as far as feels comfortable. Next step, stretch your leg until just before it hurts. I want you to feel a stretch in your leg without pain. If it hurts, just ease back a little. In this position, we're going to do the same movement with the foot and with the head. Look, lift your foot, lift your head, lower your foot, lower your head. Pay attention that I'm not moving my knee, I'm not moving my hip or my spine. It's just the foot and the head. Do this movement 30 times without rushing, rest and repeat. 3 times, that's 3 sets of 30 repetitions. Right away, you already feel your leg lighter, the pain easing up. But it's important for you to remember that in the first days, especially, you should only do this exercise once a day. That's because the nerve needs time to rest, to recover after we mobilize it. Of course. The next step is to relieve the muscle itself. And in this case, stretching is not the best option because if the tendon is inflamed, stretching will cause pain and the tendinitis will take even longer to heal. What we're going to do is release the tight spots or even the trigger points in this muscle. Stay seated in the chair, but at the edge of the chair with your foot firmly on the floor.
I'm going to lift my clothes up a little here. Look, we're going to use our fingertips to find the trigger point. The biceps femoris is in the middle towards the outside of the thigh. So take as much time as you need.
Slowly, no rush, okay? I don't want you to hurt yourself while finding the most painful spot, the most sensitive spot, or even a knot in the muscle, a knot under your finger. I found a more sensitive spot here.
At this point, you're going to apply light pressure so that you feel minimal pain and just relax. Observe what happens. Stay in this position. Maintain the same pressure from start to finish for a minute. You will feel the knot loosening, the muscle relaxing, melting under your finger, and the pain itself will decrease.
After a minute, you keep the same pressure. Don't press harder, don't try to be clever. And we will keep the pressure and move the legs slightly. Look, stretch, and return. Apply pressure with the movement for another 30 seconds. As the muscle relaxes, circulation improves. And that's where this sensation, this wave of relaxation comes from. This sensation of warmth going down your leg. It's a sign that you did the exercise correctly. And your body is thanking you. Gratitude, gratitudo. And to finish improving the biceps femoris tendon, where the inflammation happens, we're going to release the head of the fibula. When we release this joint, the leg moves more freely. We take the strain off the tendon. In other words, besides relieving the pain right away, we improve the recovery and healing of the tendinitis. What we're going to do is release and move the head of the fibula directly. I'll do it step by step. So you can find this little bone. You can come here from behind. It's right near the crease at the back of the knee. You're going to look here. Using your fingertips, you'll feel a little bump right under your finger. It's smaller than a golf ball, about the size of a marble.
If you're having trouble, you can also feel for it from the front of the knee.
Here, near the top of the shin. For some people, this bone tip is really easy to find. You're going to stay at the same level. Look, even near the back of the knee, on the side, you'll find this little bump. Go slowly and you'll find it. It's super easy.
Once you've found it, you're going to hold it from the front and the back. You don't need to squeeze it.
Here, relax your leg. Put your weight on the other leg. That's an important tip. You're simply going to push this little bone forward and backward.
Focus on keeping a comfortable rhythm for yourself. Don't worry if at first you don't feel the bone moving. If it seems like everything is stiff. Over 30 seconds to a minute, you'll notice that this little bone will start moving. That's what will show that you're, in a way, lubricating this joint. 30 seconds to a minute is more than enough. The biceps femoris can also make you tight, and this affects your knee and your spine. There's already a video here on the channel teaching how to improve this tightness with 2 exercises. Just click here to watch. And if I managed to help you today, share this video with someone who feels pain in their thigh, glute, or sciatic nerve. That's all I ask of you. Use this video to help those who need it. I'll stop here. Big hug and see you next time.